We welcome you all to this show, Dotor in the House, and we welcome our esteemed guest, Dr. Sheldon, on this show. Dr. Sheldon has passed out from the prestigious querry College of Belgaum. He has done his bachelor's in physiotherapy in 2006, and he has also completed his master's in physiotherapy from AJ Hospital and Research Center, Mangalore in 2008. We welcome you, Dr. Sheldon, to this show.
Thank you so much, Dr. Sophia.
So there is this topic called as frozen shoulder. Okay, भरपूर वेळार लोक येता शोल्डर पेन जाता म्हणून आनी शोल्डर वयर तकलीचे वयर उबारपाक जायना. ते कितें कारण, कित्याक जाता अशें?
फ्रोजन शोल्डर पळय हो जो आमी शब्द यूज करता एक्चुअली इट इज कॉमनली लायक यूज इन आय बिलीव मोस्ट ऑफ द पीपल नो अबाउट दिस टर्म बट बेजिकली फ्रोजन शोल्डर जेन्ना आमी म्हणटा तेन्ना एक्चुअली बेजिकली बुजाचो त्रास तो आनी सुरवात कशी जाता दुखपाक लागता आनी जेन्ना दुखपाक सुरू जाता ऑटोमॅटिकली मुवमेंट कमी जाता कित्याक मुवमेंट करता आसतना ती दूख वाडटा. सो ग्रॅज्युअली द पेन एंड द स्टिफनस हे दोनांचे कॉम्बिनेशन जावन मागीर तो फ्रोजन शोल्डर तो कंप्लीट डेवलप जाता.
कितलो वेळ लागता आसतलो ते जावपाक कंप्लीटली अशें म्हणजे टायम वता आसतलो न्हू स्टार्टींग पर्यान आनी मागीर फूल ब्लोन फ्रोजन शोल्डर जावपाक? आमच्या लोकांक खूब अशें वेट करपाचें हॅबीट आसता टू वेट टील दी लास्ट मोमेंट. खूब त्रास वाडटा तेन्ना येतात लोक. सो कितलो वेळ पर्यंत लागता आसतलें अशें जावपाक?
येस, बाय द टायम डायग्नोसीस जाता आनी आमकां कळून येता की ह्या पेशंटाक फ्रोजन शोल्डर जाल्यार एटलीस्ट 6 months तरी आसताच.
ओके, so we have around 6 months to actually understand that we have developed a frozen shoulder. कितें कारण दोतोर शेल्टन अशें फ्रोजन शोल्डर जावपाचें कित्याक लागून जाता हें?
बेजिकली तेका 2 कारणां आसता. द फर्स्ट इज इडियोपॅथीक म्हणटा आमी. इडियोपॅथीक म्हणजे द कॉज इज नॉट नोन, कितें कारण आसा एक्झॅक्टली खबर ना. आनी द सेकंड टायप जे म्हणटा आमी की क्लासिफिकेशन आसा ताजें सेकंड टायप इज समथींग वॉट यू कॉल एज सेकंडरी. आयदर इट इज रिलेटेड टू ट्रॉमा ऑर फॉल, इट कूड बी अ मसल इंजरी ऑर टेंडन तुजो वाडलो कितें खेळटा आसतना कितें इंजरी जाली पडलो बायकीरसान. ऑर इट कूड ऑल्सो बी कॉमनली नाव डेज वी आर कमिंग अक्रॉस इज एक्चुअली प्रेवलन्स इन डायबेटीक पॉप्युलेशन. जांकां डायबिटीज आसा तांकां फ्रोजन शोल्डर एकदां ऑलमोस्ट अबाउट 20 to 30% ऑफ डायबेटिक्स हॅव फ्रोजन शोल्डर.
सो मोस्ट कॉमनली कॉजीस जे आसता वजन उबारपाचे हातान मार्केटीन बीन वता तेन्ना आमी खूब वजनाचे वस्तू उबारतात की स्पोर्ट्सान जे आसता who use their hand and shoulder very regularly, these people have commonly developed this condition called as frozen shoulder. What are the symptoms and signs of coming to know that you have a frozen shoulder? How do you come to know?
One classical symptom, doctor, is that we come across people who actually find difficulty in sleeping. Particularly, example, if you get pain on the right side, तुका रायट सायडीन न्हिदपाक रातचे न्हिदता तेन्ना तो तुका दुखपाक सुरू जाता. मेनी पीपल इवन वेक अप फ्रॉम द स्लीप ओइंग टू दिस पेन. So that is one of the first things that people notice, and then gradually they start seeing that certain activities, overhead activities where you try to lift the hand above the shoulder level, it starts paining. These are the first 2 features.
So since it is a chronic condition, chronic म्हणजे खूप टायमान ते जाता, how long does it? I think you have already answered this question, but we'll go further to that. What are the 3 stages that we see in the development of frozen shoulder?
Frozen shoulder basically has 3 stages, and most of the authors accept to this fact. But there are few who also speak of something called as a prodromal stage. That means it's like a precursor. It's a precursor of periarthritis of frozen shoulder. And so actually in clinical experience, I have also noticed it many times, doctor. I have also found out that there are many patients in that prodromal stage. And if we catch the patient there, if we establish this diagnosis of frozen shoulder, we can really treat them at a pace that we would not be able to treat if he had come after a completely formed frozen shoulder. So the first stage after following the prodromal stage is the painful stage. The second stage is the stiff stage, and the third stage is the recovery stage. So in the painful stage कितें जाता खूब दुखता हात. Every movement, any movement, हाताक लिफ्ट करपाक जायना, फाटल्यान घालपाक जायना. It becomes very difficult even to wear clothes, especially tops, and household activities. Even some people have difficulty while bathing, while like self cleaning. And this stage, the first stage, painful stage, as the name suggests, is more marked with very severe pain. Then the second stage, okay, the first stage, basically painful stage, lasts for about maybe 3 to 6 months. And then comes the second phase. The second phase is the stiffness stage, wherein what happens is that the pain is reduced now, but the stiffness has increased. Hence the name stiffness stage. And here also similarly, but this is the place where mostly people benefit by physiotherapy. Classically, this is the phase where a physiotherapist can come into play and can really bring about a drastic improvement in the patient's condition. The third stage, what we call as a recovery stage, is a stage where both pain and stiffness have started reducing. And gradually, as the time surpasses, the pain keeps on coming down. So, like recovery phase, and चडशा लोकांक actually automatically तांचो pain reduce जावपाक लागता, stiffness कमी जाता, movement return जाता, and they stop complaining, they can sleep, they can turn their sides while sleeping, and they're much better. And ultimately, it might take around maybe sometimes 6-9 months also, depends from person to person. There's nothing like a fixed period clinically.
पण काय करनासतना रिकवर जावचे ना न्हू, मदीं दोतोरा कडेन वचचें पडटलें. सो इन अदर वर्ड्स, जितले बेगीन वता दोतोरा कडेन तें जावं कसलेंय दुयेंस, तितले बेगीन ताजो ट्रिटमेंटूय बरो जाता. ओके.
Yes, doctor.
सो what are the treatment options for frozen shoulder? ते फ्रोजन कित्याक म्हणटात सांग पळया.
Frozen basically actually like खूब authors आसा, medical authors आसा, आनी anatomists आसा, movement specialists आसा. They say that frozen shoulder is a misnomer. They shouldn't have called it, but ideally. But in the real world, in real time, it is known as frozen shoulder, and people identify it as frozen shoulder. Now, what do we do about it? We cannot do anything about it because the term is out. Once it is out, it's like, it's kind of viral, like how they say nowadays. So people are so very much used to that term that we cannot now again rename it. But in the medical circle and in the medical literature, it is primarily called as adhesive capsulitis. Another term they prefer is periarthritis. Now frozen कित्याक म्हणटा तेका? Frozen कित्याक म्हणटा? कित्याक तो shoulder movement जायना. It's like as if you have kept something in the deep freezer and you bring it out and you see that there is no movement. Hence it is called as frozen.
Very interesting. Very interesting.
To interrupt you, Dr. Sheldon, a lot of our people of Goa want to ask you one question. Okay, so let's take the first question.
हॅलो डॉक्टर, माझे नाव तन्वी आणि हांव मिरामार रावता. माझो प्रश्न असो आसलो की घरा कडेन फ्रोजन शोल्डर प्रॉब्लम कसो आयडेंटिफाय करप.
ओके तन्वी, फर्स्ट ऑफ ऑल कितें आसा, जेन्ना आमी डायग्नोसिसाचें उलयता फ्रोजन शोल्डर, like तातूंत डिफरन्शियल डायग्नोसिस खूब आसता. सो टू आयडेंटिफाय दीस एट होम इज समथींग, it's quite a tricky question and you need an expert to actually speak about this. But one thing is for sure, if you cannot do your movements तुजे सारके जायना, हात बूज तुजे सारके वयर सरना, आनी न्हिदता आसतना जरी तर तुका दूख जाता आनी तुका दिसता की लायक सर्टन मुवमेंट्स तुजे अशे पेनफूल आसता when you are not expecting them to be and your regular activities are hindered, then you need to cross check with your ortho or your physio.
So let's take the second question, Dr. Sheldon.
Yes sir.
हॅलो डॉक्टर, म्हजें नांव अदिती नायक. सो म्हाकाय फ्रोजन शोल्डराचो इशू आसा आनी तो म्हाज्या पेरंट्सांकूय आसलो. सो म्हाका आसा इनफॅक्ट. सो तांकां जशे त्रास जाता तशें म्हाकाय जाता. सो म्हाका अशें विचारपाचें आसलें की हे जेनेटीक आसा की हे म्हाकाच हेजो सेपरेट त्रास जाता.
ओके, बेसिकली आतां जेन्ना आमी जेनेटीक प्रिडिस्पोजिशनाचें जेन्ना आमी उलयता और एनी जेनेटीक लिंक बिटवीन फ्रोजन शोल्डर रनिंग डावन द ब्लड लायन, there is no strong evidence to suggest that there is, okay, but though there are studies that support ki मातशें genetic link आसपाक शकता, but nothing concrete has been established so far. म्हणजे आमच्यान अशें म्हणपाक जायना की पेरंट्सांक आसलें की आतां म्हाकाय जातलें. Okay, we have to rule out what could be the underlying cause. Sometimes it could be that it could be like a lifestyle disorder like diabetes, or it could be your posture तुजो सारको ना. जे कोण अशे राउंडेड शोल्डर्स आसता पळय तांकां हे असले जावपाचे चड चान्सीस आसता. सो वी हॅव टू रियली एक्झामीन एंड लायक रूल आउट how this genetic link is there, whether it is because of something underlying apart from just frozen shoulder.
Thank you so much, Dr. Sheldon, for taking up the questions from the public. And I have some more questions for you. So what are the treatment options? So treatment कसो करपाचो? खूब लोक येता म्हजे कडेन. आय एम अ गायनेकोलॉजिस्ट बाय प्रोफेशन, पण खूबदां येतात आनी सांगतात की बूज दुखता ताका गरम पाण्याचो शेक लावपाचो की कोल्ड कंप्रेसीस लावपाचे ताणें तें वतलें की फुडें वचून आनी कसलो ट्रिटमेंट करपाक जाय आनी कसले ट्रिटमेंट अवेलेबल आसा?
Dr. Sophia, this is a very big discussion actually on this, but since you have put it like forth in a very nice way, आमच्यान treatment actually 3 parts ताका divide करपाक जाता basically for understanding purpose. Well, one is pharmacologic, one is orthopedic, and the third is physiotherapeutic. Now, pharmacologic basically.
Let me just interrupt you again.
Yes.
Pharmacologic म्हणजे मेडिसीन जे गुळ्यान की इंजेक्शनान. ओके, जस्ट तुमकां सिंपल वर्ड्सान डिस्क्रायब करपाक. दुसरें आसा तें ऑर्थोपॅडीक म्हणलें डॉक्टर शेल्डनान, ते दोतोरा कडेन ऑर्थोपॅडिशन हाडाचे डॉक्टरा कडेन वचून ट्रिटमेंट घेवप. आनी तिसरें आसा तें फिजिओथेरपिस्ट. बाब शेल्डन आमचे बरोबर आसा, ही इज अ फिजिओथेरपिस्ट. ते वेरियस टायप्स ऑफ फिजिओथेरपी प्रोसिजर्स आनी कितें करपाक जाता ते बेटर करपाक आमचे शोल्डर ते आमकां सांगतलो. यू कॅन टेल.
Thank you so much, doctor, for helping me out here. So, like pharmacologic जेन्ना म्हणटा आमी चडशे it is actually non-steroidal anti-inflammatory drugs. This is the category that works the best, and the first line of treatment आमच्यान म्हणपाक जाता की पयलो जेन्ना पेशंट ऑर्थोपेडिशना कडेन वतलो or any physician for that matter, he should actually guide him with NSAIDs and then bring down the pain. जेन्ना pain जेन्ना कमी जाता, then the patient is ready to go for physiotherapy. Now, if the patient is not responding to the pharmacologic measures, म्हणजे वखदां दिवन जरी तर हे पेन किलर्स दिवन जरी तर पेन कमी जायना, then he might have to go back to the ortho to like discuss any future or any advanced treatment. It could be some kind of a surgical intervention, it could be a steroidal injection, or it could be a manipulation under general anesthesia, or it might be even a surgery like a capsular release. So it can go to that an extent, but this is a very small percentage of people who need this kind of surgical intervention or invasive procedures. Most of them, they respond to pharmacologic and physiotherapeutic combinations.
So let's take some more questions from the public. Let's go on to it.
हॅलो डॉक्टर, हांव तुषार नायक उलयतां बाणस्तारीसून. म्हाजो शोल्डर खूब पेन करता आनी शोल्डराचो मोशनूय कमी जाला. हाका होम रेमेडी कितें आसा सारको जावपाक?
Okay, Tushar, like I said before, just like in other to other diagnosis करता, so तुज्यान ते identify करपाक it is very difficult. Sometimes it's a challenge even for the medical fraternity to pinpoint this, and we might need certain investigations like x-rays, maybe MRI, maybe ultrasonography of the shoulder. Same way ghara treatment karpak it is little bit difficult, but if you are really in pain, then mostly what works, especially in like painful conditions, heating is preferred by patients. And heating म्हणजे आता गरम उदकाचो शेक, कपडो घेवपाचो गरम उदकान तो डीप करपाचो आनी शोल्डराचेर डायरेक्ट दवरपाक जाय, डायरेक्ट ऑन द स्किन ऑफ द शोल्डर, and do it for about 5 to 10 minutes and repeat it maybe 3 to 4 times a day. This should give you some amount of relief. Particularly this is true if you are having disturbed sleep in the night. So heating the joint prior to going to bed is going to help in a great deal way.
And we have a very interesting case which you were just discussing with me. There was a lady you said who came to your clinic, and she first had frozen shoulder on one side, and because she was diabetic was the predisposing factor.
Yes.
And then again she had on the right side. Yeah. Why do you think this can happen? Was it to equalize from one side to the other side? Why?
Yes, of course, on a lighter note we can say that, but the fact remains that with diabetic patients, the blood flow is always an issue, and we know that the blood is thicker and the blood is more sluggish. So in a joint like frozen shoulder that doesn't have a lot of collateral blood like supply, so it really needs, when the blood flows over there, it really needs it to be smooth and like reaching to the target zones. Now in diabetic patients, because of high glucose levels, sometimes this does not happen. And because of that, they have a tendency that even if they get a minor injury, that injury can lead to inflammation leading to frozen shoulder. So जर तर ट्रिवियल कितें इंजुरी जालो, पडलो, or कितें लिफ्ट करतना स्ट्रेन जालो, हेवी कितें लिफ्ट केलें, and any like tendon injury in the shoulder area which might even go unnoticed, But the capsule of the shoulder joint is so sensitive that immediately it starts moving into an inflammatory response and we have a frozen shoulder.
ओके सो लेट्स टेक अनदर क्वेश्चन फॉर यू फ्रॉम द पब्लिक.
हॅलो दोतर, हांव दीपक गांवस उलयतां. 3 वर्सां पयलीं हांव बायकान पडलेलो आनी उजवे सायडीन म्हाजो तो शोल्डर आहा न्ही तो सामको दुखता, चडूच दुखता. म्हणजे रातचो मुया येता, घटत जाता, अशी खूब त्रास जाता. कित्याक लागून?
Okay, Deepak, आता कितें करपाक जाय? तूं आतां पडलो, you had an injury. You have to go to see an ortho as soon as possible because looks like there's a problem. आनी जरी तर तुका रातचो जरी तर तुका भुजाची जरी तर दुख तुका परती येता आनी तूं म्हणटा मुयेता म्हणटा लिफ्ट करपाक जायना, मुवमेंट तुज्या टायट जाता, that means it's time that you need to see an ortho and you need to rule out other conditions. It could be like rotator cuff injury, it could be a tendon tear, it could be a tendinitis. So yes, सगळें rule out करपा खातीर you have to go to an ortho and you get it sorted out. If you have a physiotherapist nearby who knows and who deals with these conditions commonly, please go, but take some expert advice on this. This is what I would recommend. And like don't delay before it turns out to be something else.
हय, करेक्टली सांगलें तुवें. म्हणजे कितें आमी अशें समजून घेवपाक जायना की फ्रोजन शोल्डर म्हणून तो मसल इंजरी जावपाक जाता, हाड तुटलेलें आसपाक जाता की लिगमेंट इंजरी आसपाक जाता. पयलीं ते सगळे मेजर रूल आउट करपाक जाय कॉजीस. मागीर दोतोरान एकदां सांगलें फ्रोजन शोल्डर तेन्ना मागीर ताजो डायग्नोसीस जाता. दोतोर शेल्डन, तुजी प्रॅक्टीस खूब वर्सां जाली. फ्रॉम 2008 तूं पास आउट जालो म्हणजे एक 15 वर्सां प्लस.
I'm practicing since 2006
more than
actually.
15 years. कितले केसीस पळयले आसतले तुवें फ्रोजन शोल्डराचे?
Approximately around less than 1,000 or something.
आनी म्हयन्यांत कितले येता आसतले तसले केसीस?
Around 25 to 30 patients.
तूं गोंयांतूच आशिल्लो प्रॅक्टीस करतालो? इतले पेशंट आमचे सगळे गोंयचे?
हांव एक्चुअली कर्नाटकांनी आसलो जेन्ना मास्टर्स करतालो तेन्ना कर्नाटका 2 years थंय प्रॅक्टीस आशिल्ली आमची. तेजे शेट्टी एंड
पण गोंयांत खूबच केसीस आसा की एज कम्पेअर्ड टू अदर दीस?
गोंयांत केसीस चड आसा एंड आय बिलीव इट मायट बी रिलेटेड टू डायबिटीज.
बिकॉज डायबिटीज इज लायक अ कॅपिटल इन गोवा. लॉट ऑफ केसीस ऑफ डायबिटीज कम कित्याक आमचे डायट, एक्सरसाइज एंड स्लीप हॅबिट्स सामके पाड पडलेले आसा. आय एम सॉरी टू से बट येस वी आर नॉट कंट्रोलिंग आवर डायट, एक्सरसाइज एंड sleep, which are the 3 pillars of health, because all other diseases, whether it is diabetes, pressure, frozen shoulder or anything else, are related to these 3 things. So let's go to the next question.
हॅलो दोतोर, हांव रविना नायक उलयतां काणकोणच्यान. म्हजो प्रश्न असो आसा की म्हज्या घरान हालींच एका फॅमिली मेंबराक फ्रोजन शोल्डर मेळिल्लो आसा. तो कितल्या तेंपान रिकवर जावपाक शकता?
Okay, Ravina, like I said before, this is a very big question actually to answer. कित्याक आमच्यान like frozen शोल्डराक एक टायम फ्रेमीन घालपाक जायना. एंड येस, फ्रोजन शोल्डर इज अ सेल्फ लिमिटींग डिजीज. सेल्फ लिमिटींग डिजीज म्हणजे कितें आसा, तो सुरू जाता पूण तो आपुणूच तो बंद जातलो. बट तो केन्ना बंद जातलो, कसो बंद जातलो, दॅट वील बी डिटर्मिन्ड बाय युअर बिहेवियर, हाव यू आर हँडलिंग द शोल्डर, how you are like what kind of lifestyle you're living. Are you active enough? Are you moving about? Are you doing some work? Or your pre-morbid condition म्हणजे हे फ्रोजन शोल्डर जावचे पयलीं कितें तुजे एक्टिविटी लेवल्स कितें आसले, डायट कितें आसलो तुजो, एनी बॅकग्रावंड ऑफ डिजीजीस. सो देर आर सो मेनी फॅक्टर्स सो आमच्यान फ्रोजन शोल्डराक एक टायम फ्रेमीन घालपाक जायना दॅट यू वील रिकवर इन 9 months, you will recover in 12 months. But one thing is known is that when we do physiotherapy, as a physiotherapist, this is my outlook, आमच्यान accelerated healing दिवपाक जाता. So if the patient is going to take about 1 year to recover, we can actually push the patient to get recovered maybe in 9 months, maybe in 10 months. But yes, definitely we can shorten the period of your suffering.
करेक्ट. म्हाका सांग, तुम्ही ते जेन्ना फिजिओथेरपी दितात लोकांक फॉर फ्रोजन शोल्डर, ते एक्सरसाइजीस तुम्ही क्लिनिकीन शिकयतात, ते घराय करपाक जाता की इट इज पॉसिबल यू हॅव टू कम ओनली टू द क्लिनिक?
There are certain things here now. This is a very good question, Dr. Sophia, thank you for bringing this up. When the patient comes in to us in the painful stage, the first stage, as the name suggests, there's a lot of pain, dukh asta, खूप dukh asta, movement करपाक जायना, like कपडे घालपाक जायना. Some people cannot even comb their hair, some people cannot even eat food with the right hand, if it is the right hand. So there is a lot of suffering, there's a lot of it's quite, the pain is disabling. Yeah, that would be the term that's going to like sum up the suffering. So in these kind of cases, the patient has to come to the physiotherapy clinic, has to be seen by a physiotherapist, because the physiotherapist literally, and I like to use this term, and as I speak to my juniors, I do use this term, handle the frozen shoulder in the painful stage like a baby. तू जरी तर तेका एका धाकट्या भुरग्या भाशेन जरी तर shoulder handle करपाक नको, then the physiotherapist might not be able to give the relief the patient is expecting. So the painful stage is a stage where you cannot do much at home.
Yes.
And as the patient comes into the second stage where there is stiffness, yes, once we train the patient up and the patient has learned quite a lot, especially technically जरी तर पेशंटाक जरी तर ते कळून येता की हे एक्सरसाइज ह्या प्रमाणेन करचे पडटा, जाल्यार तांच्यान मागीर ते मागीर कॅरी ओवर करून आपणे घरा करपाक जाता.
Okay. Let's go over to the next question from our dear people of Goa.
हॅलो, हांव दिपाली धारगळकर उलयतां. म्हाजो एक क्वेश्चन आसलो, डॉक्टर, फिजिओथेरपी ही फ्रोजन शोल्डराचेर कशी वर्क करतात हें म्हाका मातशें जाणून घेवपाक जाय आसलें. मातशी तुमची म्हाका गायडलायन्स मेळटली?
Yes, Dipali, thank you for this question. आताच सांगला हांवें Dr. Sophia की in the first stage, in the painful stage, you have to go to a physiotherapist because your shoulder needs to be handled in a very professional manner, because any wrong movement can immediately lead to accentuation of pain, aggravation, exacerbation. कितें जावंक शकता. Sometimes it is so bad that the pain in the frozen shoulder can even bring on mild like fever. So people have sometimes 100 degrees, 101 also because of the pain. And there are a lot many issues related to this shoulder, consider you being the breadwinner in the house. Your work gets affected. If you are a housewife and people are like banking in our background, in the Indian context, everyone banks on the woman for the household work, and especially the kitchen and cooking. So it really affects not only that person's life but everyone's life revolving around that particular person. So it's something that like physiotherapy can help in a great deal, but we have got tailor-made programs for each individual. Not necessary that आता जोण एकलो कोण पेशंट येता तेंकां ते सगळ्यांकूच ते सेम एका प्रोग्रामान
इंडिव्हिज्युअलाइज द पेशंट.
Absolutely.
आमी दर ह्युमन बींग वेगळो आसता आनी ताजे सगळ्यांचे ट्रिटमेंटूय वेगळे आसता.
Absolutely,
सो
doctor.
वी हॅव टू इंडिव्हिज्युअलाइज ईच पेशंट एज अ पर्सन
Yes.
अँड नॉट जस्ट एज टेक्स्टबुक नॉलेज. एवरी पर्सन इज डिफरंट.
Rightly said.
आनी एक इंटरेस्टिंग क्वेश्चन विचारता तुजे कडेन. जेन्ना येता पळय एक लुकान तुका कळटलें न्हू फ्रोजन शोल्डर आसा म्हूण. वॉट इज दॅट लूक वेन द पेशंट एंटर्स? बूस अशे असतात न्हू,
Yeah,
एक सायडीन
yes,
ड्रोपिंग न्हू.
yes.
सो दॅट इज समथींग ऑल्सो दॅट यू सी की अशे स्ट्रेट हात धरून बूज एक सायडीन सकयल धरून
Yes.
एंट्री करतले म्हजे क्लिनिकीन की तुजे
Many a times,
क्लिनिकीन.
yes, absolutely, many a
सो
times.
ते मुवमेंट करपाकूच ट्राय करिना कित्याक तांकां ते खूब दुखता. ओके, आतां हांव रेगुलरली जिमांत वयता, लिफ्टींग बीन करता वेट्स. तुका दिसता अशें की जिमिंगांत बीन खूब वता भुरगे बीन आमी सामकी उमेदीन वता, स्टार्ट करताय बीन उमेदीन. लिफ्टींग करता तेन्ना वेट तुका अशें दिसता की ट्रिगर जावपाक जाता फॉर फ्रोजन शोल्डर इंजरी जावन हांगा?
Yes, absolutely possibility आसा डॉक्टर. In fact, खूब जाण पेशंट आसा जे एक्चुअली हेवी लिफ्टिंग, वेट लिफ्टिंग बी करता आनी तांकां टेंडन इंजुरीज आसता, व्हेरी कॉमन एक्चुअली. आनी रोटेटर कफ इंजुरीज खूब आसता, इम्पिंजमेंट सिंड्रोम्स आसता. नाव दीज आर ऑल टेक्निकल टर्म्स.
Yeah.
सब एक्रोमियल बर्सायटीस आसता, बट सो
लेयर्स आसता. पयली
Yes.
स्कीन आसता, फॅट आसता, मागीर कार्टिलेज आसता, मसल आसता.
Yes.
तेजे सगळ्यांचे इंजरी जावपाक जाता
जावपाक
विच एवर इज द सिवियरिटी ऑफ अ एक्सरसाइज. तूं सडनली हांव गेलें समज जिमान आनी जे यूज ना मनीस आनी 80 किलो उबारले जाल्यार जातलेच इंजरीज. म्हणून आमी स्लोली स्टार्ट करतात एनी एक्सरसाइज फॉर दॅट मॅटर.
definitely.
सो यू मस्ट हॅव सीन सच केसीस,
Yes,
करेक्ट?
of course, doctor. Say actually sports injuries are very much linked to frozen shoulder. But then, the outcome is better because mostly athletic population जे असता or those who are into a workout, तांचे कितें तांचे mindset एक different असता. They are ready. They understand the old age saying, that the old saying, that says no pain, no gain. So they can really push themselves. Even with physiotherapy, we need that kind of a mindset.
So it is
to,
sweet pain, huh?
Yes, it is kind of like sweet pain. So it is, yes, of course, sports injuries can lead to frozen shoulder.
Okay, on a happy note, thank you for giving us such wonderful information on such a simple yet such a complex topic. Thank you so much, Dr. Sheldon, for coming to this show, Dotor in the House.
Thank you, doctor. Thank you so much.